an epidemic, either naturally caused or intentionally caused, is the most likely thing to cause, say, 10 million excess deaths, and that it's pretty surprising how little preparedness there is for it. Now, it's tricky because this is a global problem, so how do countries work together? Which countries should put up what resources? And every aspect of it, the resources to go engage in the affected countries, the allocation decisions.
On the coronavirus, experts are warning it's likely to become a pandemic. There are at least 11 confirmed cases in the U.S. Fears the number of cases in China could be far higher than reported, 17,000 now.
There are at least 11 confirmed cases here in the U.S., including one in Boston.
Reports of a confirmed case, the 12th in the United States, in Wisconsin.
Yesterday, I had put this up on yesterday's video update, and I said that this model was predicting that these would be the numbers that would come out end of day yesterday on February 4th. And indeed, when those numbers came out, here's what we saw. Instead of the 23,803 predicted, it was 23,865, 99%. That would sort of imply you might get alignment and fealty with that number. And instead of 499 deaths, it was 479 reported again. That's what we were expecting. And here's what we expect to see for today at the end of the day. 27,571 and 576. So we'll keep track of those.
Dr. Amesh Adalja is a senior scholar at the Johns Hopkins University Center for Health Security, and Drew Mattis is chief market strategist at MetLife Investment Management. And Doctor, let's start with you. Just in terms of how prepared the United States is, how high this ranks on a concern for you, what do you say?
The U.S. is rapidly trying to prepare its healthcare facilities in order to receive what's probably going to be a surge of patients as this virus spreads in the United States. We have to really assume now that
containment is going to fail
based on how many cases we're seeing and this wide spectrum of illness with many mild cases that may not even be being diagnosed, but yet are still contagious.
2 flights carrying American evacuees from China landing at 2 U.S. military bases where the passengers will spend 14 days in isolation, quarantined in rooms similar to this one, while health officials monitor their conditions and test them for the dangerous coronavirus. The illness already killing hundreds in China and infecting at least 11 people here in the U.S., including a California man visiting this hospital, testing positive in order to self-isolate at home. The hospital
in order to self-isolate at home.
Employees he came into contact with now also quarantined.
Containment is going to fail. Containment is going to fail.
Containment is going to fail. Containment is going to fail.